ask you something else, though,
I agree.
Senator,
I agree.
that is of a pressing concern, doesn't get enough attention. Let's give it some right now. Opioids are presenting a scourge to this country, unlike anything we've seen since crack, and many experts say worse, because it's coming out of the medicine cabinets as much as it's coming out of the street, and that doctors are passing it along as much as any other drug pusher. What can be done? We know you're at the front of this.
Yeah, Chris, I totally agree with you. It's an epidemic now, and I say that not lightly. I mean, it is a crisis. I just got off the phone with someone from Akron, Ohio this morning. They had 15 overdoses in a 10-hour period in one city in Ohio. We believe there are 200,000 people who are addicted now to these opioids in Ohio. That's the size, by the way, of the city of Akron. It's the #1 cause of accidental death in our state, surpassing car accidents. We now think that's probably true nationally. As you know, in New York State, some of the same issues have occurred. So this is something that has to be addressed in a more comprehensive way and in a different way. The legislation I've been pushing basically says, let's divert people from the criminal justice system into treatment. Let's be much more aggressive on the prevention and education. You mentioned prescription drugs. 4 out of 5 heroin addicts probably started with prescription drugs. And many of those, Chris, as you know, started with getting a painkiller. I have, 2 families have come to me in Ohio. I've been working on this for, over 2 decades now, and so I have people that come up to me and talk to me about this. 2 families have come to say their teenager got a prescription drug for a extraction of a wisdom tooth that led to an addiction, that led to heroin, that led to that young man and young woman dying. So, I mean, we do have to deal with this prescription issue. Part of our legislation has a new national awareness program making this connection between the overprescribing you talk about and the addiction and ultimately the overdoses and the deaths. And that has to be out there. Otherwise, more and more people are going to make these bad choices. Finally, I would say that law enforcement plays a big role here, as do our firefighters and others, the first responders. So we help in terms of the training on how to deal with overdoses, more funding for Narcan and so on. And then more funding for treatment. It's absolutely necessary. The president has now come on board and said that he'd like to see more funding too. I couldn't agree more. But let's be sure the money is going to what we know works. Sheldon Whitehouse of Rhode Island, a Democrat, and I have spent 3 years putting together this legislation, which we think will pass the House and Senate over the next week.
Well, we will.
And it says what works, and let's get the money into those things that do work on treatment, recovery, prevention, education.
We will follow this, Senator. Please let us know what information matters, and we will work our hardest to get it out. Yeah. Absolutely, Senator.
You're raising awareness by doing that, and that will save lives, Chris.
Well, that's part of the job. Senator Portman, thank you very much for being with us this morning.
Good to talk.